Um, so thank you everybody for tuning in. This is a monthly installation of Innovation Conversation, and this time we are really truly privileged to have Daniel with us. My name is Millie. I'm a global innovation advisor with UNDP. Francesca, do you want to go ahead and introduce yourself, or you've already done it and everybody's heard you except me?
I think I already done it. Everybody listen to me.
Okay, all right, super. So the innovation conversations are really envisaged for us at UNDP to come across very interesting people and organizations who are doing work that could be valuable for us in UNDP and about which we don't necessarily may know much about. So by connecting with these practitioners, we are likely to accelerate our own learning about what are they doing, and we can become more valuable to our partners. Today we have chosen a topic that is without a doubt on everybody's mind in the time of social distancing, and I put it in quotes because Daniel will be really quickly to correct me and say it's about physical distancing, but social connectedness. Daniel Aldrich is somebody whose book I have recently read as per suggestion of Giulio Quagiotto, who is really a sort of a father of innovation in UNDP, went through it in 2 days and was absolutely stunned to learn that, and I'm sort of really over summarizing here, Daniel will have a chance to go through his research. The line that struck me from that book is that it wasn't the physical infrastructure that saved lives, it was the social infrastructure that existed in communities in Japan, one of the countries that was the topic of the research that Daniel was doing. So we pinged Daniel last week, and he has generously agreed to spend some time with us to talk to us about what are social ties, why do they matter, how do we strengthen them in these unprecedented times when personal contact is shunned. We're all asked to quarantine, which is bizarre because one of the biggest addictions that we as human beings have is addiction to other human beings and social contact. So with that in mind, Daniel, I will turn over to you for an introduction and maybe a deep dive into your research on social ties and why we should all care and what we can do. Over to you.
Thank you, Millie. Thank you, Francesca. Thank you all for coming today. So on this very first slide, which hopefully is visible, my email address is there and my Twitter feed as well. If you have questions that we lack time for today, feel free to reach out to me via email or Twitter. I'm happy to respond in both medium. I just want to really quickly talk about why I care about this idea. And hopefully you're able to see right now, the first slide is a map of the city actually of New Orleans, Louisiana. And now 15 years ago, I moved there in the summer of 2005 with my wife and 2 small children. We were there for 6 very good weeks when afterwards Hurricane Katrina arrived and destroyed our home, everything that we owned. It took out our car, our hard drive, paper records, toys. We had nothing left at all at the end of that evacuation procedure. But watching our family, our neighborhood, and the city recover over time really pushed me to think about what factors help people, communities, and cities build up resilience to shocks, whether short-term on-side shocks like a hurricane, slow ones like COVID-19, and we could talk about other things as well if you want to, tsunami, fires, and so forth. What I noticed doing research, and this map that you see is one of the things that Rick Wheel and I produced. It has on it 3 types of data. The first, of course, is geographic data. The blue at the top is a lake. The blue at the bottom is the Mississippi River. It also has water depth from flooding. When we saw the amount of water coming in, we mapped it into less than a meter, 1 to 2 meters, and 2 to 5 meters. The deep blue is the heaviest water, the whiter is the less water. And the third type of data on there is how people's recovery went, how people reported things were going for them in that period after the shock. And you see, we've coded it from red, very bad recovery, all the way to green, a good recovery. The interesting thing for me was doing this research, it's quite obvious that the deeper water areas didn't have more red dots, meaning the shock of having more water didn't translate into worse recoveries for many people. In fact, if you look closely, if you can see that map, there are a lot of greens area, even in the very deep blue areas. meaning a lot of good recoveries in very bad shock areas, but also a lot of reds and oranges in very low water areas. This is the first hint that I saw that maybe the process of recovery, the process of resilience doesn't come from the shock itself. A pretty common message that we do hear, both during COVID-19 and other shocks though, is that in getting ready for a shock, it's on the individual. And we hear this all the time now. Do you have a kit? Do you have food and water? I've got a teddy bear in that image. I think this is from Australia, if I remember correctly. This image is the kind of, do you have a kit ready for going? Is your individual preparedness doing well? And again, that's a pretty common response. The other very common response we see during big shocks is what I call the tsunami wall response. When the government says, don't worry, we have this, we're building some kind of massive infrastructure, we're building new hospitals, we're building new seawalls, we're going to protect you from whatever the shock that's coming is. And this is an image from Japan, actually, after the tsunami, when the government built brand new seawalls to replace those that were damaged in 2011. The individualization and the government top-down, neither response, I would argue, is what we need right now, or during any shock. What we need right now are bottom-up, community-based responses. And that's really this next image, are the types of connections that we have. Social ties, the ties between us, can be bonding, bridging, or linking. Bonding social ties connect individuals who are similar, same background, ethnicity, religion, and so forth. Bridging ties often come through institutions, clubs, schools, workplaces, and those connect people who are different. Both bonding and bridging are horizontal ties, the same levels of power and authority. Linking ties are vertical ties. These are between me and the chancellor of my university, or between you and the mayor or the governor. I'm going to argue today that all three types of connections are critical during any kind of shock. The first thing that we need during a shock like this is the ability to work together collectively. Staying home right now, for example, is a good example of collective action. All other kinds of examples we can think about during a shock, if there's no police force available, how do you keep homes safe? You might have a community patrol. Individuals in the community itself walk around the area nearby. So in all these communities, we need people to work together. If you have strong social ties, if people know each other, they trust each other, they work together, under those conditions, it's far easier for us to envision the possibility of a collective action outcome. If we don't trust each other, if we don't work together, I don't know who you are, it's much more challenging to get us to coordinate our activities. The other benefits that come out of having strong social ties are what we call informal insurance or mutual aid. Hopefully most of us have health insurance, life insurance, car insurance, all those financial-based insurance schemes. But this is based instead on trust, investment in time. Do you know your neighbors? Have you built up those ties before the shock arrives? If you have, when that shock does arrive, when the COVID-19 order comes or the tsunami arrives or there's a fire coming nearby, your neighbors and you can work together. You can have people taking care of each other's children when kindergartens are shut down. You'll have information on what to do during that shock from people whom you trust. And you may have other resources as well, food, water, and medical supplies. But let's very quickly give you some examples from around the world of we've seen these kind of social ties in action. The first, even before the shock arrives, these social ties drive a lot of responses. For example, we tracked people's movement days before large-scale hurricanes arrived in North America. That red dot you see centered in Miami, Florida, were the individuals in the evacuation zone of Hurricane Irma. Many millions of people stayed there as the hurricane came closer and closer. The blue dots you see spreading out over time, those are individuals leaving the vulnerable areas and moving to safer spots. You see when the hurricane finally arrived in early September, many individuals had moved out from the vulnerable areas, but others remained. What factors helped them move out? What gave them the ability and motivation to leave? We found having broader and more diverse networks, having more bridging and linking ties, helped individuals move out of a vulnerable area even before the shocks arrived. So that was one moment, even before you have the event. Those social ties help individuals think through what their options are and have motivation to leave and act properly. We also tracked who survived during the 3/11 Japan disasters, the tsunami, the earthquake, and the nuclear meltdowns. And we recognized across coastal areas in Japan, survival rates varied tremendously. In some communities, no one passed away as a result of the tsunami. In others, as much as 10% of the community died. And there are all kinds of arguments that we heard from people. What was it that drove these differences in survival rates? Some people argued it was the power of the wave. Others argued it was politics, determining who got what assistance beforehand. Others argued it was the engineering, the kind of seawalls in place. Many of us talk about vulnerability and the elderly during a shock like this. The other argument that my lab made early on was, what if it was that in these vulnerable communities, strong social ties, the ability to work together collectively, could save lives during that tsunami? And in fact, reviewing over 20,000 deaths and the survivals of many other people, we found the best predictor of community survival rates came from strong social ties, holding all the other factors constant. Income, demographics, politics, and physical infrastructure, the best predictor of people getting through a major shock like this came from the ability of the community to work together. We also tracked the recovery after the shock, looking at how did communities along the coast hit by a 60-foot, a 20-meter tsunami recover over time. And we found, again, strong variation across small villages, towns, and cities. Some bounced back quite quickly, going back 60% of their recovery in less than 2 years. In other communities, though, they moved much more slowly. What was it in some communities, whether it's Ishinomaki that rebuilt their downtown, or Tagajo over time that rebuilt their area, what gave them the ability to rebound? We found it was vertical linking ties. Did communities have strong ties to decision makers and abilities, to people who could bring in aid and assistance? Very few small communities have the financial resources they need to rebuild, whether it's an economy or damaged buildings, and they need those vertical ties to bring in aid. One last area my lab has looked at has been mental health, especially during shut-in periods, like after the Fukushima nuclear meltdowns, where hundreds of thousands of people had to shelter in place, in some cases for months, if not years. And of course, the levels of mental health varied across individuals. Some individuals had almost no negative response to the idea of the shock itself, the radioactive exposure, and then being shut in over time. Others had a quick dip down and then bounced back. Others, unfortunately, had a slow decline in mental health. What kind of factors might play a role across the 140,000 evacuees from the areas near the nuclear power plant in Fukushima? Well, we looked across a number of villages to track the Kessler-6, the K6 indices of those individuals, and to compare them over time and space. We found early on that typical demographic factors like income and health did not have an impact on mental health. That is to say, being physically healthy or being wealthy didn't help you bounce through that shock with any betterness than being poor. But we did found over and over again, the best predictor for recovery was having strong social ties. Individuals with neighbors whom they knew, with friends nearby, those individuals who had those social ties were able to get through that long-term shock and concern about health and livelihood and rebound to relatively normal levels of mental health. So if these social ties, in fact, are critical predictors of both behavior before, during, and after a shock, what can we do as NGOs, as residents in our communities to build up and build back these kind of strong social ties? We really have 6 categories of programs we've been involved with. And maybe many of you recognize this image of the red sweater man here on the top, of course, Mr. Fred Rogers. Of course, where you live, where you are, you know all of your neighbors. But where I live in Boston, many of us don't know our neighbors' last names. In fact, around the world in most urban centers, whether it's Boston, Mumbai, or Bangladesh, fewer than 1 in 8 people can name their neighbors' first and last names. And that's critical because during shocks like COVID-19, when we're trapped in our homes, or broader shocks like fires, earthquakes, and hurricanes, our immediate neighbors, the hyper-local individuals in our networks, those will be the first responders. If, for example, I can't get off the floor to call 911, if I need food or water and I can't get out to a store or a shop. So Mr. Rogers said a long time ago, the key to living a strong life in these moments is being a good neighbor. And many of our programs in Australia and elsewhere push the idea of building these ties, building connections hyper-locally between me and people who live nearby. The next level up from neighbors is neighborhood. How do we connect the community as a whole? Not just living near me physically, but even a little bit further away. We call this the Neighbor Fest approach. And right now in San Francisco, at least once a year, the city has $5,000 for your neighborhood to have a party. That $5,000 will go to helping you, for example, buy food and water, a bounce house for the kids, to provide things that you need overall that will make that party more successful. Because even planning a party itself forces you to work together and think through, how do we get food to someone up on a high floor? How do we involve someone whose English is a second language? How do we involve neighbors from foreign countries whom we don't know so well? How do we get the entire community involved in this social event? So neighbors, neighborhood. The third level image there is the city itself and city planning. We know the physical spaces where we live strongly impact the kind of ties that we build. One of my graduate students, Courtney Page Tan, had to count the trees in the neighborhood of Cambridge because we wanted to see, does shade encourage individuals to have conversations? By the way, it did, in fact. We found out over time, having a place to stand when it's hot gives people a place in common where they can have those connections form. The next three ideas are a little bit higher up. The bottom left image is having a kind of boring meeting, maybe like this one, when a talking head is blah, blah to you and you're just sitting there listening. These kind of meetings, zoning meetings, school board meetings, civic engagement, civic democracy, these are so critical for democracy to flourish. We need individuals across our society, not just the same 5 people who always show up, but new individuals to come. So part of our lab thinks through, how do we engage people to come in and get involved in sitting planning, zoning meetings, school board meetings? Can you have the same meeting at multiple times? Can you have it virtually? Can you offer food and childcare? What can you do to make it more engaging for citizens? The next idea is community planning involving faith-based organizations. At least in North America and elsewhere, we have a number of individuals involved in churches, synagogues, and mosques. We want those centers of social life, whether they're there physically or virtually, to be part of the process of thinking through planning for a shock like this and the recovery as well. How do we engage those faith-based networks in the long term so they're part of city planning for shocks like this? The final idea I want to mention is what we call community currency or time banking. Very popular, for example, right now in Onagawa, Japan, in Ithaca, New York, in Littleton, New Zealand. These are communities that want to encourage volunteering and civic engagement. And they offer individuals a reward, some kind of incentive to participate. If I volunteer for an hour in Toronto, I'll get 5 Toronto dollars. Those can't be spent at some mom and pop store, McDonald's or Burger King. They only can be spent at local businesses. They only can be spent at mom and pop stores nearby. So I'm encouraging myself to volunteer, then local businesses get my currency and they give it to other local businesses, creating a virtuous cycle. And in fact, we've built a program called Ibasho, first in Japan in Masakicho, and now in Nepal and the Philippines, that embodies these ideas of bottom-up community engagement run by the local community, where they set the programming goals, and their whole idea is to build social engagement and trust through these kind of processes. We found, fortunately, Ibasho and other projects build social ties, they widen the network, they build a sense of engagement and efficacy, the sense of connectedness, and also the idea of wanting to stay in place. So just to wrap up now, I would say there are several core ideas here. One is where many of us think about individualization, building my own kit, or the government top-down approach in terms of responding. In fact, it could be the bottom-up community-based engagement is the most critical, whether it's during COVID-19 or another moment. Those horizontal ties between me and neighbors, me and people living nearby, me and my networks, those are critical in surviving a shock, whether it's COVID-19 or a tsunami, but also in the long term in building mental health back. The vertical ties are also critical for getting an information, building trust between decision makers, and also bringing in the concept of ideas of how do we make sure that the local people are connected to their decision makers in power and that their voice is being heard. Finally, the argument that we're making here is social ties and social capital is not set in stone. It is very possible to build these, to build them up through bottom-up engagement. They're not set by past experience or history. They can be created over time and through our engagement. And these are just some of the books that I've written on this kind of stuff. Happy to stop sharing now and talk and take questions.
Thank you very much, Daniel, for the presentation. The topic is absolutely fascinating and extremely timely, especially for an organization as UNDP that is already called to support the government and to face the crisis. So let's jump immediately to some of the questions. We are receiving a lot of them. So let me introduce you to the first one. So as you might understand, during this time, a lot of initiatives that we are seeing today about social capital hinge on the access to digital resources and connectivity. So for example, museum offering virtual tours, or university offering online courses for free, etc., etc. In the context of development, as UNDP works on various aspects of inequality, digital divide being one of the manifestations of the unequal access to resources. So what are some options that you can suggest for social connectivity in places that have low to no access to internet, digital resources, or electricity for that matter?
Yeah, this is a great question. In fact, we saw this in countries like Japan post-shock, when there was no internet in some places for 2 weeks and no power and water. Part of this is the power of hyperlocal ties, to have built those connections beforehand. And then even after a shock, for communities who are more fragmented, to be able to travel to them, to provide notes, for example. We've seen this now in Boston and elsewhere, literally handwritten notes that say, hi, I'm Daniel, I'm your neighbor. Here are the resources I can provide. I have toilet paper. I might have water or food. I am offering a chance to walk to the park with your dog if you want to, at a distance of 10 feet away. So there are a number of different things that we can think through that even with paper, without having to use engagement of more sophisticated techniques or internet or radio waves, we can do that. We also know, by the way, radio programming is quite powerful. We've done some research primarily in the Sahel, in places like Mali and Timbuktu, where we've seen radio programming. Again, not sophisticated, but people having an AM or FM radio nearby can receive messages built by local NGOs, local groups, talking about here's what's going on, here's accurate information, here's the kind of abilities and resources we have for you, and here's what you can do as well. So again, you don't necessarily need to have Wi-Fi or mesh networks or sophisticated satellite phones. Whether it's a radio process or notes, I think it is possible to build communication channels between individuals, even those who are trapped right now.
Daniel, we have another question that says, what are some examples of, have you come across examples of community resilience initiatives to provide aid to informal workers, those without access to social protection and other social safety nets, that are being left behind in the midst of the crisis, losing their daily sources of livelihood? You spoke about the project in Philippines. Maybe expand a little bit of that, and then the other examples that might be relevant.
Yeah, sure. So the project called Ibasho, I-B-A-S-H-O, Ibasho, began in Japan with Emi Kiyota, and then spread from there to the Philippines and Nepal. And I've been fortunate to be a member on helping measure that teamwork. But what's amazing about that is it's not about financial services per se, it's more about social connectedness. And the programming they run there is programming interested in and by local communities. So for example, if the community wants a yoga, they run yoga programming. If the community wants to do work that's instead on a library for children, they'll do that. That is bottom-up driven interests, not about, for example, financial compensation, but more about ties. To transfer to the idea about financial ties, what we can do, I've seen a number of different processes right now. Some of them, for example, are collecting resources, financial aid, and gifts for example, frontline workers, individuals who need to have the children watched. I've seen free childcare offered by some communities for those frontline workers losing livelihoods. I've seen attempts, for example, to do cash mobs rather than flash mobs, where we target local businesses who are right now suffering and say, look, maybe tonight we'll all buy a pizza from a takeout restaurant nearby or from another kind of store nearby, a convenience store that isn't having customers. So again, this is where those hyperlocal ties are so critical. What we should be thinking about are not the chain stores, not the large stores. CVS, Walgreens, Walmart, Kmart, those big national stores will be fine. They have logistical processes. What we should be thinking and worrying about are the local stores, the stores that are not based on the internet, the stores that are not based on large complex supply chains, but rather based in communities. Those are the ones we should be reaching out to and offering our aid and our support.
Thank you, Daniel. Another question, and I think this is extremely important for United Nations in general and in UNDP certainly. Have you observed any differences in how men and women deal with social isolation and how they're affected by it and how do you respond to it? So we are looking at the problem actually with the gender lens.
Yes, so absolutely, gender makes a difference here. I can give you some examples from Japan. It was typically the older men who had the most difficulties in finding new connections. That is to say, older men over the age of 70 often became shut-ins, did not leave their home, and we had to deliberately think through what are the social activities that would get them out of their homes. One of the solutions in Futaba, for example, was woodworking. It sounds like an interesting hobby, but it got them out of their temporary shelters into the public sphere where they can engage with other men and work together. Women, by and large, from our measurements at least, seem to have stronger social ties, more resilient networks, and they better be able to connect new people quickly. That is to say, they rebuild those ties, even post-shock, in ways that men, unfortunately, I do not see that regularly happening.
So another question, we have Vito playing a devil's advocate, and I think he's right to do so, because we are talking about a bit of a different situation here. He's saying, to play the devil's advocate, one could argue that, on contrary, dense social networks might have helped spread the virus. Indeed, if one looks at Italy and Spain, where social networks are quite dense, the virus is spreading the most. This, to me, hints, Daniel, back at the difference between social versus physical distancing. Social distancing is not, so physical distancing does not imply social distancing, yes?
This is a great question, and Vito is exactly right. It could be, for example, communities that are more gregarious, outgoing, where there's more physical interaction, are the ones where we did see a faster spread. That's certainly one theory we have right now. But regardless of how COVID-19 spreads, physical distancing and social connectedness can happen simultaneously. Meaning, right now, even though all of us might be in different countries, different societies, some of us are eating our lunch right now, maybe going to bed soon, whatever we're doing, we can still connect right now over Zoom or whatever we're using. So the platform itself, the concept of social ties, remains a critical factor. I can give you a number of examples. Individuals right now who are isolated, who are by themselves, not only do they lack information, for example, on what they're going through, that is to say, maybe they don't know the difference in symptoms between COVID-19, the flu, and a cold, or what they'll need to do if they can't call an emergency service, so that information will come to them, but they're also lacking resources and emotional support. All three things, information, resources, and emotional support, those come directly from our social ties. We're able to access them and do well. I think I mentioned the mental health component already. This is a very critical point. It could be, as in China's case, it was 2 months, more or less, of being locked literally or welded into an apartment complex or a home. 2 months when daily routines, normal rituals of religious practice are cut off, we can't walk around, etc. During that period, it's incredibly important to maintain our ability to connect socially to people, even if we can't physically be near them. The resources that we need. I know that my neighbor and other people right now, my wife is out handing out vegetables to people who don't have food services, who don't have access to food, who can't go shopping, and people in my community are offering to go shopping for them, people who can't go out and buy things. So those are two ways with resources that, again, if I'm shut in literally and socially, I'm not going to be able to access what is a critical component at this moment, which is to say, how do I get access to food? How do I get access to information? And how do I access to reassurance and normalcy? So it's absolutely true. Physical contact, which might have come from strong social ties, may have been a cause of a faster spread, but regardless of that process, we still need to maintain these strong social ties, especially during a shock like this one.
Thanks, Daniel. This is very interesting. This pandemic is putting to the foreground the question of trust in relationship between the citizen and the state, which is part of your social ties model. Many states are asking their citizens to self-quarantine, some mandating it straight up, which implies sacrificing individual convenience for the benefit of both individual but also the collective good. What action can the state take in these unprecedented times of physical distancing, limiting movements, and shutting down of borders?
This is a hard question to answer. So social trust is hard to build and easy to damage. So for example, when the Japanese government began suppressing information on the radioactive meltdowns, Japan went from one of the most trusting countries into the world to the bottom 15% of not trusting the government. The average citizen in Japan right now, for example, doesn't believe a lot of the things being said by the central government. We also see this divide in North America, where I live, a polarization even by political party in trusting information. It is a very challenging process. My advice would be the following. Every local and regional government has a better chance of building trust with citizens because there's more interaction over time. It's a longer term relationship. As we say in political science, it's a repeated game. In contrast with national level politicians or pronouncements when on top, the best chances to build trust with citizens will always be coming from more local and regional governments than from some national government, whom I may only see as a face on a screen or a notice in my inbox that I'm now being quarantined. So if the goal here is to build trust, if the goal is to listen to information and find it trustworthy, we need to have openness, transparency, and regular interaction. And I think this is what we're seeing from, for example, Governor Cuomo in New York, daily press briefings which are honest and open, where there's a lack of information and it's admitted. There's no promises of future behavior that we can't undertake. So a lot of the processes that we're seeing here are an attempt to build trust, where right now in North America, perhaps the average person may not trust what we're hearing from the national administration.
So maybe along those lines, Daniel, there's a question about, and there's an assumption in here. How do you build social ties in the short term if they do not exist? So I suppose my question onto Christian's question is there such a thing as social ties not existing, or they're not explicit in the middle of the crisis? Think about informal waste pickers who are now impacted by not being able to do their economic activity. How do we build the linking ties they need to bring in the aid?
Yeah, the two tough questions. I'll try the linking ties first. When I was doing research in India, for example, the Indian government recognized the gap between many citizens, especially of the lower caste citizens, and the government itself. And their response is quite interesting. They would fly government officials out to communities, peripheral communities, that really had no contact whatsoever with people, whether they're collectors, as they're called, at the state level, or other representatives, or they would fly representatives from communities on the periphery into the capital to meet with them and to have those interactions. That was a very radical plan, to literally fly them to meet each other on a regular basis. But for whether it's a rag-picking community or other peripheral areas, peripheral jobs and peripheral social communities, I think at the end of the day, the only way to build those linking ties is to begin having that regular communication. And again, for many governments who on a regular basis don't have that peripheral social groups as part of their goal, that can be really challenging. Certainly right now, as I mentioned, in North America, there's a polarizing gap between the political parties on contact even and trust. I'm not sure there's an easy answer to reach out right now during the shock. One of my colleagues always says, if you're giving out a business card after the event, it's too late. People should already have met you before you had that fire happen, before you had the tornado. It's much more challenging, as Rob Olshansky says, to build trust in a compressed time moment, like right now, when we have so much going on. We have livelihood shocks, we have health shocks, we have health capacity shocks, we have multiple shocks going on. To begin building trust right now, I would say, is the most difficult time to build it in.
Yeah, and I think we have a colleague, Gustavo, who is agreeing. So he's basically saying in many countries the vertical ties are highly overdeveloped and clientelistic. They serve for certain kind of protection, but reproduce the political and social subordination that keeps vulnerable population during the crisis very difficult. So maybe a question. So we have one question from somebody whose name I can't read. Based on several Chinese experiences, elderly people can help young people to establish more stronger responses to continue staying at home and to submit to the political requirements. Sorry, this wasn't a question. Let's go to the next one. Afreen, do you know of examples where local or higher governments have learned their lessons from crisis and incorporated it into their policy actions, where they're now better prepared to respond to the next one?
Yes, two examples I can give. One would be Kobe, Japan. So Kobe, before the shock, had very little civic engagement, very few individuals involved in planning for disasters or anything generally. After the 1995 earthquake, Kobe flipped the model. They brought in thousands and thousands of hours of volunteers to interact with city planners and managers in planning the recovery process, but also planning more broadly, what kind of city do we want to build? And since that point, Kobe has much been more engaged. I'd also give the example of the Wellington Regional Emergency Management Organization in Wellington, New Zealand. There, especially after the earthquakes back in 2011, even before then, they have put so much effort as an agency into reaching out to the community, to building trust and building ties. And again, especially to communities where English is a second language, to new migrant communities from places like Afghanistan and Syria, to reaching out to religious, ethnic, and even social groups. So that much of the time the agency spends is not top-down pronouncements from public relations, but rather they embed 1/3 of their staff in these social organizations all the time. At any moment, 1/3 of their staff are out in the community, literally sitting in meetings, going to school board events, going to zoning meetings, to build up that long-term connection so citizens look to them and trust them when the shock will arrive.
Thanks, Daniel. I want to pick your brain now, so something very selfish. In UNDP, we are present in 170 countries in the world and support governments and our partners to shift their development trajectories to achieve the SDG. So one of the core strengths of our organization is actually its physical presence. What advice do you have for us? How do we keep investing in social capital and ties across the world while we are working remotely?
Yeah, I mean, part of this is always going to be the power of the community itself. I think part of our lab's argument is that resilience is always the internal characteristics of the community, right? That gets help, aid, and advice from outside. So if you're a virtual team, for example, working in another country, I did some work in West Africa myself, then in those moments you have to think, do we have a team on the ground that's invested in the community? Is our team incorporating people in the community? How do we show them that what we're doing is actually not for some broader top-down policy interest, but in the long term, we'll be building up strength, capacity in the community itself. I think from the very beginning, all of our agencies, whether it's educational or outreach, should always have a board of local residents, of individuals who know the community really well and can guide us. Is this program that we have, this new idea, really relevant here? Is it going to help? If so, what form should it take? How do we get individuals involved? So what we try to do as a lab is we build these community advisory boards anywhere we go someplace and try to recognize their input will guide how we respond and how we build our research. I would say for any community that wants to have that long-term tie, you've got to be there for a while. The other danger, what we've seen regularly is oftentimes if there's a shock, experts come in, they're there for 2 or 3 weeks, they give their advice, they hand out something and they leave again. That kind of 1 month response time it feels necessary, but again, it's not going to build the long-term connections that we need if we want to have trust and reciprocity over time.
Thanks, Daniel. And something interesting on ties and vertical ties, especially from Gustavo. Following up on Christian's question, many countries, the vertical ties are highly overdeveloped and clientelistic. They serve for certain kind of protection, but reproduce the political and social subordination that keeps these populations vulnerable. Does the crisis provide opportunities to change this structure?
Yeah, this is a hard one. A lot of the countries that have clientelistic ties have other both capacity and transparency problems at the same time. We don't need to name any countries, I'm sure you can all think of examples where you've worked in a country and it's been very challenging to get things done in an open way without having to sort of work through bribery or transparency or certain organizations. Again, part of the argument here is local-based organizations based in the community, they can, to some degree, right, avoid at least a national or regional oversight that is more corrupt or clientelistic. If there, for example, are certain firms that always win every contract, right, or certain organizations that always are on top, thinking through how to diversify that, how to build that in. I know when I worked for USAID, a lot of the work was about how do we build a process that will deliberately diversify the involvement from private sector, public sector, and local residents. How do we make sure it isn't the same people over and over again? Those clientelistic ties where certain groups help their friends rather than helping society as a whole. I think also data and transparency. The more that we can show over and over again, here's how that money is being spent, or here's how the organization's having an impact. Those are the moments we have to think through. What is it that we're doing that has an impact beyond just that very narrow slice of the population that might already be not so vulnerable? And I think this is the sad message, unfortunately. Many times, clientelistic ties mean you're not assisting those who actually need the assistance. You're assisting those who maybe already have connections. We've actually done this research, for example, on water resilience. In some countries in South America, those communities that got the new devices to help build resilience already had connections in other ways. It wasn't the most vulnerable among them. So again, using data, can we figure out who was benefited by this program? Who are they vis-a-vis the population? How's it going to change for the next stage if we iterate that?
We have another question from a colleague in Latin America who is wondering about the role of social ties in governance and social conflict. So Rodrigo's question is, can social distancing hinder collective action and conflict resolution? And what can we do? If yes, what can we do to prevent that?
So again, I would use the word physical distancing. And if we're talking right now about COVID-19, at some level, honestly, physical distancing can push us into new technologies and new platforms that we might not normally use. I'm on one right now. I don't normally use Zoom or have conversations around the world like this, but it can be a moment, I think, especially in communities that already have been split, to think through how do we reach out beyond that same group of people that I know pretty well and interact with someone on the other side. And again, this might be if you already have a pre-existing connection, can you think of an organizational topic? Can you think of a lecture or a concert or event virtually that would bring those groups together, whether it's from a popular celebrity, whether it's from a local activist, whether it's from a politician? What could you do in the community itself that would reach out beyond those pre-existing boundaries between groups? And then again, thinking through platforms, are there ways to do this in a safe way? Again, most countries now do have some basic Wi-Fi or radio capacity. We don't need something sophisticated if radio programming can work. Why not go back to the older ways, to use radio, to use other methods that don't require me to have either a Wi-Fi connection or my own personal phone?
Thank you, Daniel. Another question, what could be the role of social networks in re-establishing stronger social governance versus the approach saying the market that we sorted out?
Yeah, so again, this is the question, if I understand, between sort of markets and the public institution. Is that the question?
Yeah, I think so, yes.
Yeah, I mean, so I would say like this, honestly, we really want public-private partnerships as much as we can. I know oftentimes businesses are the last organizations that we turn to, but in many ways, businesses, again, if they're local businesses especially, they're on the ground, they know what's going on. Owners of businesses in the community are invested in the community. They're there to stay. If I own a coffee shop here in Boston, I really want to know what's going on. I want to be able to provide drinks to go right now in a safe way. I want people coming to my stores. You know, those local businesses should be part of any kind of social capital building that we have. They should be advertising the process. Business owners should be involved in the process. You know, if we're talking about market-based solutions more generally, again, here I think there are many interesting things that we've seen where public and private partnerships work together to think through how do we maximize the number of individuals involved. Again, not clientelistic ties, not one group or one political party, but across the community, businesses can be the ones who get the message out and get involved as well.
I think you've been on the receiving end of the shotgun 30 questions. Maybe one more, Daniel, sort of appreciative of your time so far, is a colleague wants to know about the role of not just nucleus family, but the family members that might live outside the borders. And for UNDP, and I would imagine a number of development organizations, this is very relevant insofar that we work in countries where a large numbers of population live outside and are members of diaspora, part of diaspora. So what are this, who are physically distanced just by the nature of, you know, decisions about, you know, where they're going to live, where they're going to work. So what are some of the examples that you have come across that in that moment of physical distancing, diaspora can play a role in social capital?
Absolutely, and we know this, whether it's in the Philippines, for example, and Puerto Rico, both of which have a large percentage of their population outside their homeland, but are strongly tied back in. And again, this is one of those moments when technologies, whether it's money transfers, for example, which in some of these communities actually is the core economic driver for backland in the homeland itself. So transfers from diaspora communities back to the area, information on what's going on, political lobbying. After Puerto Rico's hurricane, a number of Puerto Ricans based in North America lobbied for changes in regulatory procedures that slow down the recovery process. And the same thing as well in the Philippines. A number of Filipinos around the world involved in thinking through how do we make it easier, for example, for visas, for transportation and everything else. So absolutely, diaspora communities are an existing network right now, where so many individuals are not based at home. They can't go home for whatever reason. Maybe their airline is shut down or whatever, but they're able to participate in that. They feel that connection. And I think this is, again, when those moments of social connectedness. If we feel connected to a community, if we feel a sense of voice and place, we're going to lobby for that community and be involved. It doesn't matter if we're physically there or someplace else. And this is a powerful lesson for us, right? Whether it's the Philippines or Puerto Rico, we can still positively affect change wherever we are, if we feel that the community itself is part of us. We feel that connection. So this is a good example, I think, of physical distancing with strong social connectedness.
Okay, Daniel, really the last one, but I think it's very relevant for UNDP because we work a lot with youth. Do you have an example of region countries with strong youth engagement, youth movements, and positive relationship with recovery after a disaster?
Yes, a number of communities actually have taken the expertness of disasters and place it in a curriculum in schools, so that now K through 12 communities, whether it's in Japan, for example, or in Chile, are often exposed to the concept of what is a disaster, what should I do, how do I help my community, what does resilience look like in the long term? So a number of communities hit by shocks like tsunami, again, whether in Chile or in Japan, have built programming on disasters into schools. So that's now part of the matrix itself. And those children go home and educate their parents. It's kind of a flipped concept here, where the schools themselves are the institution providing access to the homes. Maybe the parents couldn't have gone to school, maybe they weren't able to do so. Children in those educational institutions can bring home ideas and educational programming. And here again is an idea as well, children exposed to the concept of resilience, of social connectedness, children encouraged to reach out to the other. From a very early age, we know we can change the curve. It is possible to encourage, whether it's ethnically divided communities or religiously divided communities, it is possible to build up among children this sense of broader vision of who I am and the communities I connect to. So I think it'd be a fantastic idea to think through how do we engage and embed disaster recovery, resilience, and social connectedness into broader educational institutions, as we've seen already in Japan and Chile.
Super. We've got several more questions, but we also want to be respectful of your time, and I'm sure you have other things to work on. And if okay with you, we would sort of get this offline to you and make sure that we feed back to colleagues. If that's okay. On behalf of Francesca and I, broader UNDP team that has joined in, but also a number of other colleagues and friends who have tuned in for the call, thank you so much for your time. We in UNDP are on the board and thinking how to develop a more of a surge offer around building or rather reinforcing and augmenting social ties and capital in these times, especially in the developing world. So rest assured, we will come back knocking on your door for support and potential collaboration moving forward. Daniel, thank you so much for the call today.
Happy to be here. Thank you so much.
Thank you, Daniel. And thank you, everybody that is connected. Bye-bye.
Thanks so much. Bye-bye.
Thank you so much. Bye.